Buenos dias and good morning. Welcome all to the 2020 Mom Conference. And what an honor to be here with you today to share my story. Mariel, respira profundo. I remember gasping for air and feeling foreign to myself. I had my first anxiety attack when I was 7 months pregnant with my first child. I didn't have the words to explain to my husband or to my mommy what I was feeling. Everyone said it was normal to feel stress with the arrival of a new baby. Normal. I didn't know what normal was. I had a traumatic birth with my first child. My epidural procedure failed after the needle was jammed into my back, despite asking them to stop. The injection sent immediate pain through my back and up my skull. I birthed my child with an oxygen mask on, and I blacked out the first week of her life due to the excruciating spinal headache. My mommy, she was with me during the transition into motherhood. She left when Mariel was 2 weeks old. I was alone. No one to help me, no community around. I was trying to forget my traumatic birth story, heal from the infected wounds, and bond with my baby despite the lack of sleep. All of this while navigating what I didn't know was anxiety and depression. Me acuerdo como lloraba mientras cargaba a mi bebé, tratando de entender qué había hecho yo para sentirme tan lejos de ella. I remember holding my baby and crying, wondering what I had done to feel so distant from her. I tried to explain to my pediatrician what I was feeling. I again was told it was normal. Days, weeks, and months passed. I sank deeper into what felt like a black hole. I remember calling my mommy crying, and she would tell me, "Échale ganas, mamita, reza, no te des por vencida que tu bebé te necesita." I cried because I felt like I was failing as a woman and as a mom. I was trying hard every day, praying. I didn't want to give up, but there were days I felt like not waking up. Survival felt like it was slipping my fingers. Finding help felt almost impossible. In my teary eyes, I remember being vulnerable and telling both my OBGYN and my pediatrician I wasn't okay. They asked me if I had thoughts of harming myself. I didn't. But living also felt really, really hard. For months, I looked for help. I finally found a community mental health agency that had a slot open for me. Weeks went by before anyone called me. I remember asking for a Latinx provider because I felt like I needed to express myself in my own native language of Spanish. And I knew I needed someone who understood my experiences, but there were none. I was finally matched with a provider, and they didn't show up to our first consult. I never came back for help. Instead, I slept for what felt like weeks at a time. Days and weeks where I spent less time with my baby and even missed her important milestones. Mariel was blessed to have her papi present when I was in my darkest place. But I will always mourn all the special moments we missed together. And I always think about the children who may not have caregivers or other protective factors when mom is in need of help. Mi experiencia no es única. My experience isn't unique, but my experience is that of a first-generation Mexicana with a graduate level degree, employed with medical insurance, and with the knowledge of navigating our confusing and broken health system. But what about women like my mommy and mis tías, immigrants with broken English that rarely can afford to get care? What about our mujeres that are separated from their babies and children in search of safety and opportunity? Our mujeres who suffer separation at the hands of our policing systems like the child welfare system? What about our mujeres who are dismissed and ignored because of the color of their skin or because of their cultural and religious practices? Many moms in our country, especially women of color, fall through the cracks of our systems, and my story is a call to action. Una llamada de acción for systems to create accessible, timely, and responsives to support moms survive and thrive, to support and embrace workforce development across community and health systems that allow all moms, regardless of their religion, ethnicity, or language, to feel heard and seen when they need it. This story is dedicated to all the mamas and mommies that feel invisible and that live in silent pain, waiting for systems to finally care for them. No estás sola. You are not alone. Thank you for letting me share my story.
Mariel, thank you for sharing your story and putting us in your shoes as a mother who experienced a traumatic birth and who had no clinical support, as a mother who suffered from a subsequent prenatal anxiety, who was dismissed and not supported by your care team, and as a Latina who reasonably sought culturally competent care and mental health care and found a care desert instead. Your story is like so many and also reminds us of how important it is to screen for anxiety and not to forget to screen during pregnancy.